Imagine a world where doctors have AI-powered assistants, systems that can diagnose diseases faster, more accurately, and even catch health issues before they become serious. This isn't sci-fi anymore, it's happening right now. Today, we're diving into how AI is shaking up healthcare, from diagnosing rare diseases to creating personalized treatment plans. Stick around, because by the end of this video, you'll see how AI is changing the game in medicine, the rise of AI in healthcare. From crunching massive amounts of data to analyzing complex diagnostic algorithms, AI is making a huge impact on healthcare. And it's not just about making things more efficient, it's about saving lives. Take this example. Think about a rare disease that's often missed early on because its symptoms are vague or overlap with common conditions. Traditional methods might fail to catch it in time, but AI, it doesn't miss a thing. There's an AI system that's trained to analyze thousands of medical records, compare symptoms, and flag those rare cases before doctors even think to check. And get this, AI has even outperformed doctors in diagnosing things like early-stage cancer and sepsis, two things that can be deadly if caught too late. With this technology, we can catch diseases earlier, giving patients a much better chance at beating them. Imagine what this could mean for preventative care and early treatment. AI in medical imaging and diagnosis. Now let's talk about how AI is changing the game in medical imaging. X-rays, MRIs, and CT scans are some of the most powerful diagnostic tools we have. But even the best doctors can miss tiny details. That's where AI comes in. AI algorithms are ridiculously good at spotting abnormalities in medical images, things like tumors, fractures, and even subtle signs of disease. Research has shown that AI can sometimes find things in scans that even expert radiologists might overlook. Take breast cancer detection, for example. AI models have shown higher accuracy in analyzing mammograms, helping doctors catch tumors early when treatment is most effective. This means AI isn't just helping speed up the process, it's improving accuracy, making diagnoses faster, and ultimately leading to better patient outcomes. With AI, doctors can focus on the bigger picture, knowing that the system is catching all the small details that could make all the difference in a patient's treatment. AI in drug discovery and development. Now let's get into drug discovery. Normally, developing a new drug can take years and cost billions of dollars, but AI is changing that by speeding up the process. AI analyzes massive amounts of data, everything from molecular structures to patient histories, and can predict which compounds might work as potential new drugs. For example, AI has helped researchers discover potential treatments for cancers, Alzheimer's, and even COVID-19. One exciting example, an AI algorithm recently helped find a possible treatment for a rare form of leukemia, speeding up the research timeline by months. But AI isn't just about discovering new drugs, it's also personalizing treatments. Imagine a future where your doctor can prescribe the perfect medication for you, based on your unique genetics and medical history. That's the power of AI, taking medicine from one size fits all to a tailored solution just for you. AI-powered personalized medicine. Speaking of personalized treatments, AI is already being used to customize care based on individual patients. By analyzing everything from a patient's genetic makeup to their lifestyle, AI can help doctors create the best treatment plan for them. Let's say you're prescribed a medication. AI can predict how your body will respond to it based on your unique DNA, helping doctors avoid side effects and making sure the treatment is as effective as possible. Of course, with all this power comes a big responsibility. There are ethical issues to think about, like data privacy and bias in AI algorithms. It's crucial that as AI advances, we stay focused on making sure it's used fairly and ethically. So, what's next for AI in healthcare? We're just getting started. Imagine robotic surgery, where AI can guide the scalpel with pinpoint precision, reducing human error and speeding up recovery. Or think about AI-powered virtual assistants that help patients keep track of their health, remind them to take their medication, and even book doctor's appointments, all from the comfort of their homes. AI-powered personalized medicine. As AI continues to improve, it has the potential to address some of the biggest challenges in healthcare, like making high-quality care more accessible, reducing costs, and ultimately saving more lives. But to make all this happen, it's going to take teamwork. Doctors, researchers, and AI developers need to work together to make sure these tools are used ethically and responsibly, with patients' best interests at heart. In the end, please like, share,